Welcome to Clinical Tools Library, evidence-based scales and questionnaires designed to support healthcare professionals in practice. The Rosenberg Self-Esteem Scale assesses global self-worth by measuring positive and negative feelings about the self. Its main purpose is to evaluate an individual's self-esteem level in both clinical and research settings. The scale consists of 10 items that reflect self-acceptance and self-respect. It is widely used to identify individuals at risk for mental health conditions such as depression and anxiety. The instrument provides reliable and valid quantitative data to inform psychological interventions and monitor treatment outcomes. The Rosenberg Self-Esteem Scale is indicated for use in diverse patient populations, including adolescents, adults, and older adults experiencing psychological distress or low self-worth. It is widely applied in clinical contexts involving depression, anxiety disorders, substance use disorders, and eating disorders. The scale serves as a valuable tool in mental health assessments to quantify global self-esteem levels and monitor changes during therapeutic interventions. Its reliability and validity have been confirmed across various cultural and clinical settings, supporting its utility in both psychiatric and primary care environments where self-esteem impacts overall mental health and treatment outcomes. The Rosenberg Self-Esteem Scale consists of 10 statements designed to assess global self-worth. Each item is a declarative sentence reflecting self-regard. Respondents rate their agreement using a 4-point Likert scale: strongly agree, agree, disagree, or strongly disagree. 5 items are positively worded, while 5 are negatively worded, requiring reverse scoring for the latter. Scoring involves assigning values from 0 to 3 for each response, with higher scores indicating higher self-esteem. The total score ranges from 0 to 30. Scores between 15 and 25 suggest normal self-esteem, scores below 15 indicate low self-esteem, and scores above 25 reflect high self-esteem. Clinicians should consider cultural and contextual factors when interpreting the score, ensuring it aligns with the individual's background and clinical presentation. The sensitivity of the Rosenberg Self-Esteem Scale refers to its ability to correctly identify individuals with low self-esteem, while specificity indicates its capacity to correctly recognize those without low self-esteem. In clinical studies, the Rosenberg Self-Esteem Scale has demonstrated sensitivity ranging from approximately 70 to 80%, meaning it accurately detects 70 to 80 individuals out of 100 who truly have low self-esteem. Its specificity generally falls between 80 and 90%, reflecting correct identification of 80 to 90 individuals out of 100 who do not have low self-esteem. For example, in a mental health screening context, a sensitivity of 75% suggests that the scale may miss about 25 individuals with low self-esteem, potentially requiring supplementary assessments. Conversely, a specificity of 85% means that 15 individuals without low self-esteem might be incorrectly classified as having low self-esteem, impacting the precision of diagnosis. The Rosenberg Self-Esteem Scale was developed in 1965 by Morris Rosenberg as a unidimensional measure of global self-esteem. Since its inception, the scale has undergone extensive psychometric evaluation across diverse populations and cultural contexts. Reliability analyses consistently demonstrate high internal consistency, with Cronbach's alpha coefficients often exceeding 0.85. Test-retest reliability studies report stability coefficients ranging from 0.7 to 0.9 over periods of several weeks. Validity evidence includes strong convergent correlations with related constructs such as self-concept, social functioning, and psychological well-being. Rosenberg and colleagues originally validated the scale using a sample of high school students, and subsequent research has replicated its factor structure and psychometric properties in clinical and non-clinical adult samples worldwide. Factor analyses generally support a primarily unidimensional factor structure, although some studies identify method effects associated with positively and negatively worded items. Cross-cultural validations indicate that the scale maintains measurement invariance across different languages and demographic groups. These findings collectively establish the Rosenberg Self-Esteem Scale as a reliable and valid instrument for assessing global self-esteem in both research and applied settings. Thank you for watching. For complete information and official PDF resources, visit clinicaltoolslibrary.com or check the link in the description below. And don't forget to like and subscribe for more clinical insights.